everyone, and welcome back to the Down Syndrome Center of Western Pennsylvania podcast. As always, I am your host, Dr. Kishore Velody, and you might recall from a recent podcast that we did with skin conditions in people with Down syndrome, we had Dr. Jillian Rork join us from Dartmouth to be able to share with us her expertise and her knowledge in skin conditions in general, but also specifically in those people who have Down syndrome. And it is wonderful to have her back today for part 2 of our podcast. Dr. Rork, thank you so much for coming back.
Oh my goodness, my pleasure. Excited for part 2, Dr. Velody.
You know what I'm thinking, in the era of Zoom, to say that you came back, you're probably in the same location, but in the end, we are together on a podcast. Again, excited about continuing. For folks who, this is your first time listening to this, I really, really encourage you to go back, listen to the first podcast. You'll be able to hear a little bit of Dr. Rork's background and her interests. But what I'd like to do is just kind of jump right back into it, if that's okay with you, Jillian. So our next one is a 12-year-old girl who has this kind of yellow-white scaliness on the scalp and some red spots in the armpits. So would you mind telling us what this is and how would you manage this?
Sure. So this is dandruff. And the fancy word of saying that is seborrheic dermatitis. And, when we've gone through and done kind of large retrospective reviews of patients with Down syndrome, what do they have on their skin? Like, this is really high up on the list. So we don't know why that is. Even though seborrheic dermatitis or dandruff is so common, there's still kind of an unclear understanding as to why it happens. We think that it may potentially have to do with some yeast overgrowth. And so we'll touch upon that again when we talk about some of the treatments. These 2 slides show the scalp and the armpit, and that's actually pretty deliberate because we always think of dandruff of just something that can happen on the head, but it can actually happen in different parts of the body. The armpit, as we've just said, but also on the face, especially kind of in the middle zone of that face, within the eyebrows, around the nose. In babies, it can happen in the diaper area and in the skin folds. So I think that's a really nice pearl to know about, that maybe that scaly spot in the armpit might be linked to what's going on the head. In terms of treatments, a lot of the times we'll start out with over-the-counter anti-dandruff shampoos, such as a Selsun Blue or a Head and Shoulders. One big tip that I tell people especially when they're treating this on the scalp, is you want to think of those shampoos as a treatment for the skin on your head. You don't necessarily want to think about it as a treatment for all of the hair. And so you really want to focus on getting that shampoo on the scalp. And as best you can, trying to let it sit for 1 to 2 minutes. And, man, do I know that that's tricky. But sometimes, it's nice to have it sit. There are prescription antifungal shampoos. So, for example, 2 are ketoconazole 2% shampoo or cyclopirox shampoo. Oftentimes, I will prescribe one of those and then have you use those one day, and then the next time you're washing your hair, use an over-the-counter and kind of alternate between the 2 shampoos. That oftentimes is really helpful. Sometimes, go right ahead.
I was going to ask you, is there an age where you would have any caution for using this shampoos? Like if we see this in a 6-month-old baby?
Yeah. Sure. Yeah, it's a great question. So I'm not a big fan of using these shampoos in little kids. And I think it's because they're just too irritating. Oftentimes if an infant or a toddler has dandruff, or what we would call cradle cap in that age, I'm a big fan of coconut oil. And just massaging a little bit of coconut oil on the scalp a couple times a week. That oftentimes loosens the scale. But this really cool thing about coconut oil is that it actually has some anti-yeast and antibacterial properties to it. So oftentimes it can kind of help with that component of the condition too. What you never want to do to a baby, to a toddler, to any age, is try to scratch off the scale. That is, no, please don't do that, because you may end up, breaking the skin and sometimes causing other infections. So I oftentimes say, just let the shampoo, let the oil, let the medicine do the work.
Okay,
If
so
you
no need
want
to
to,
comb through or anything like that, right?
yeah, I mean, just
Okay.
massage with the
Okay.
tips of your fingers. Sometimes, I'll say a really soft bristle toothbrush, but nothing harsh.
Okay. Great. Well, let's look at another one then. Let's say there is a 13-year-old girl who has these red bumps on her back, on her bottom, and on her thighs. So we'll start with this picture, and then I think there's another picture after this that shows what could happen if it goes on for a long time. Do you want me to hold on showing that one right now?
Yeah, let's hold on showing
Okay,
that, and
perfect.
let's talk about this. So,
What is this? Yeah.
so this is called folliculitis, okay, which when we break down what that means, it means irritation around where the little hair comes out of the skin. So I know in the first episode I talked about, how I got interested in this. In working with patients with Down syndrome and skin, and folliculitis is really the reason, because I would see so many people with this skin condition, and then I would go and try to read about it and say, like, how can I help these patients? And no one was really talking about this, 5 years ago. And this was such a common skin complaint. And in fact, when we've done research and gone back looking at skin complaints as to why patients with Down syndrome come to the dermatology clinic, like, this is the number one reason. So I really want people to know about this. Folliculitis is very common in Down syndrome, and it tends to love the bottom, the backs of the legs, and also sometimes the back. And it's a real problem. It's very uncomfortable. I know, Kishore, you've probably seen it a lot in your clinic. Yeah. Yeah. And, it's interesting. We're still trying to figure out, like, why is this more common? We think that, there's a couple different mechanisms with the trisomy of the 21st chromosome that lead to follicular plugging, which basically means kind of like plugging of that hair follicle unit. There's also potentially, some predisposition to increased bacterial infections and yeast infections. We're trying to sort that out. But this is a big problem. And you can go to the next slide now, if you don't mind. There are case reports of this, and I've certainly seen this in our clinic, that if folliculitis, those bumps, are left unchecked, it can actually lead to pretty significant scarring. And we have a word for it. It's called anidoderma-like scarring. All that means is that the scars kind of, the skin kind of pouches out, where that bump was. And this is pretty disfiguring. And so we want to try our best to try to control this, to prevent this from happening.
So what is the management that you recommend for?
Yeah. So, it's a big spectrum. Honestly, a lot of patients do really well with just using an over-the-counter wash that has benzoyl peroxide in it. And that's kind of an antibacterial wash. And using that a couple times a week as a body wash can be very helpful. Now benzoyl peroxide washes, they come in all different strengths. And we talk about this a lot in my office, that oftentimes some of the ones that you'll see have 10% benzoyl peroxide. You oftentimes don't need that strong of a wash. So I would encourage using a benzoyl peroxide wash that has, 3.5, 4% benzoyl peroxide in it. Because if you use those higher strengths, sometimes those washes can be drying. And as we talked about in the first episode, like, dry skin is such an issue. So trying to use those weaker benzoyl peroxide products. I will also sometimes add in topical antibiotics, like clindamycin lotion is one that I use quite a bit. It's really important, if you're going to use clindamycin lotion, to use it with a benzoyl peroxide wash, because they just work better together. And using a benzoyl peroxide actually cuts down on antibiotic resistance. Okay, so clindamycin is an antibiotic, and if you use it over time, kind of unchecked, your body can get used to it. So one way to prevent that from happening is to use a benzoyl peroxide wash with it. So I always say those two, they got to be best buddies, like they got to go together. Sometimes we will use brief courses of oral antibiotics. We have to be careful with that. Obviously, we don't want to be over prescribing antibiotics for this, but sometimes I do find that brief courses of it can be helpful.
What about, do you ever use, sometimes when I see this, the families will say, summertime when she's in the pool all the time, she doesn't get it, but in the winter she gets it. Do you ever chlorinate the bath water?
Oh, totally. Yeah, you read my mind. That's what I was going to talk about next. Yeah. So bleach baths. Oh man, do I sound crazy when I say that in clinic? But bleach baths are actually really helpful. And in, let's say, a younger person or someone who likes to take baths over using the benzoyl peroxide, the bleach baths can be a nice alternative to that. So now that does not mean that we pour a whole bunch of bleach into the tub. I have a recipe that I give in clinic, and depending on how you take your bath, it's about a teaspoon per gallon or a fourth of a cup for a full tub. And I tell people to kind of fill up the tub, pour in the bleach, swish it around, and play in it like you're playing in a public pool, but man, is it a whole lot cleaner in your own bathtub. And so we use that for this, for folliculitis. We use that for eczema and all sorts of other things in dermatology, but that is a great pearl Kishore, and I would definitely keep recommending that in your clinic.
Perfect. All right. Well, let's look at this next condition, which will be, this is a 15-year-old who comes in with these red bumps and like boils in the armpits. How would you manage this? What is this? How would you manage it?
Sure. So this is something called hidradenitis suppurativa. Man, do I wish that they had an easier name than that, because I know that's a mouthful, but this is kind of on that spectrum of folliculitis. And oftentimes that condition we just talked about, oftentimes a lot of patients, if they have folliculitis, they oftentimes have hidradenitis suppurativa too. And so we really think of it as a spectrum of these, quote, follicular occlusion, or like kind of irritated around the hair follicle conditions. This is another reason why I got into dermatology and Down syndrome. I saw so many patients who struggled with this, didn't know what this was for years, was misdiagnosed with, I have MRSA infections, I have staph infections in my armpits and my private parts, and what is this? And the answer is, it is hidradenitis. We in the dermatology community, I think from the last couple of years have had just such tremendous leaders in dermatology really invest in this condition, and we're making so many strides with it. So a lot of people come in and they've been told, like, there's nothing I can do about this condition. And that's really not true. We're really trying hard to change that. So why this happens in Down syndrome, it's kind of similar to folliculitis. We don't totally know. We think potentially it has to do with some immune dysregulation, maybe some uptick in T cell immunity, interferon, and then also this thought that there might be increased levels of amyloid due to trisomy 21, and that can kind of lead to some downstream effects that might lead to this. There's also this whole thought too that like the microbiome is just different in these areas where hidradenitis happens, which is again like in the armpits and in the groin, sometimes on the breast too. And so so there's that whole question too. In terms of treatment, we start out with a lot of the treatments we just talked about with folliculitis. So using antiseptic washes like benzoyl peroxide, sometimes some Hibiclens, using topical antibiotics. But there are other treatments than this too. Hormonal treatments can sometimes be quite helpful for women, such as oral contraceptives. And there are a couple that are approved, just for acne, for example. We use a lot of those sometimes to help this condition. There's another hormonal treatment called spironolactone that can be helpful. But there are injections now approved by the FDA. One's called Humira, which is the TNF alpha inhibitor, that can really help with this. And that's FDA approved for 12 years and older now. And so depending on the severity of hidradenitis, we'll kind of figure out where to land on the treatment spectrum. I would really urge parents and patients that if you have this condition, you absolutely should see a dermatologist, because we can help you. We can help you navigate all these treatments. You don't have to suffer with this really uncomfortable condition. So
great. All right. Well, thank you. Okay. Well, let's look at this next one. This is a 17-year-old woman with these dark scaly areas on her neck. We're looking at her side and I think back of the neck here. What is this and how do we manage this?
Sure. So this is something called Acanthosis nigricans. This is a tricky thing to manage. I don't have great treatments for this, unfortunately. Sometimes using moisturizers that have a little bit of keratolytic in it. So we talked about this in the earlier podcast with a form of dry skin called keratosis pilaris. That can be helpful. But the most important thing that I want people to know about this skin condition is that it can sometimes be a sign of insulin resistance. Mm-hmm. And so we need to be paying attention to blood sugars and making sure that we're not, developing diabetes, mm-hmm. And really pay attention to glucose monitoring. I definitely see it more so with obesity too. And I think it's kind of linked to that insulin resistance. So if you have this, you should be talking to your doctor about making sure that glucose is doing okay.
All right. Well, then let's think of our next one, who's a 25-year-old who has these scaly brown spots in the shapes of circles on the backs, the elbows, and the knees.
Yeah, so this is psoriasis. And this is psoriasis in someone who has a medium to darker skin tone. And Kushara, I'll have you turn to the next slide because this just kind of shows psoriasis in a lighter skin tone. And obviously they look really different. Yes. So we want to make sure that we kind of know what they look like in different skin types. So, there are some studies that say that psoriasis is a bit more common in Down syndrome. And then there's others that, there maybe isn't an increased prevalence. Let me tell you, there aren't a whole lot of studies about Down syndrome and skin. So I don't know if I have a good answer yet, but I definitely have helped to take care of patients with Down syndrome who have psoriasis. This is, again, one of those conditions that I think you should see a dermatologist. Mm-hmm. There's a huge spectrum of this. Sometimes it's a few scaly spots on the skin and we can use some topical steroids and it works well. And there's other times that you're covered in it. I do tend to find that if you have a more severe case of psoriasis, if you have Down syndrome, that sometimes the stronger medications, like injectable medications, don't work quite as well. And we're studying this. We're going to start studying this as a pediatric dermatology community to try to figure that out, because we've definitely have had some challenging therapeutic cases. So I think there's more to come on Down syndrome and psoriasis. But certainly, please know that this is a potential skin condition that can pop up with Down syndrome, and go see a dermatologist if you have this.
That's great. And I appreciate you including the pictures with different skin tones, because boy, it's so much more common if you Google psoriasis to see the picture with the pink raised lesions with the scale. So it's very helpful to see that. Thank you.
No, of course. Yeah. No, we need to do a better job of that. Really talking about different morphology and different skin types. It's really important.
Well, let's look at then our next patient who comes in as a 4-year-old girl who has these new whitish spots on the eyelids. Where did this come from, and anything we can do for it?
Yes. So this is a skin condition called vitiligo. This is also considered a more autoimmune skin condition. The other one that we talked about previously was alopecia areata. Mm-hmm. So this is also a skin condition where I would make sure that thyroid testing was up to date, because sometimes those two diagnoses can walk together. So vitiligo, actually much like alopecia areata, is kind of in a treatment revolution phase, which is awesome.
Mm-hmm.
I think that for so many years there was this thought like, there's not really anything I can do about this. But I think from some really excited, influential scientists like Dr. Harris at UMass, we're starting to learn more about this and we're starting to get better treatments. There are topical options, both of which are prescriptions. So something called tacrolimus, and another thing, topical steroids. Mixing those two and alternating those two can oftentimes be really helpful. We can use a light therapy, actually, and that's pretty effective for vitiligo. So what does that mean? It doesn't mean go to a tanning booth. Please, 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 no, no, no. It means that we actually have dedicated light box therapy units in a lot of dermatologist offices. That harness certain wavelengths of light to treat skin conditions. We learned this from the Egyptians. It's a very, very old technique. And it can actually be really helpful with vitiligo. So if you have this condition, you need to see a dermatologist, and they can talk to you about some of these potential really effective treatments. I do find that kids, especially on the face, are very responsive. And, so specifically for this child, I would prescribe tacrolimus because it's safe for the eyes, and have them do it twice a day for a couple of months. And I bet you would see pretty impressive results. So certainly things that we can do about this.
Fantastic. Yeah, that's great to hear. There's so many, because it's not always just focused on the face. I mean, vitiligo could be really anywhere, right?
Absolutely.
Yeah.
Yep. And there's all different kinds. It can just be on one area of the body, or it can be all over the body. And we kind of have treatments depending on how significant it is and where it is.
Awesome. All right. Well, moving along here, we're going to have a 12-year-old who has these little bumps around the eyes. So what are these, and is there anything to be concerned about?
Sure. So these are called syringomas, which basically means that it's a bump made up of a sweat gland, and they're not harmful. They're actually completely benign. They're pretty common in Down syndrome, and they're far more common in girls and in females. They are notoriously, I have to say, tough to treat. Sometimes we can use topical prescription medicines called retinoids or tretinoin to help. But I do have to say that they are harder to treat, which is frustrating. I never like to say that, but they are fortunately not harmful.
Will they self-resolve?
Sometimes they do, sometimes they don't. I see them in this case in a 12-year-old, but I also see them in adults. So they potentially have the chance to, but usually I would say no.
Okay. All right. Well, then let's look at an adult, a 38-year-old who has this appearance to their toenails, this thick and yellow and brittle and kind of scaliness around the toes. So how would you what is this? How would you manage it?
Sure. So this is toenail fungus, or kind of the fancy word is onychomycosis. It oftentimes is paired up with athlete's foot or tinea pedis. It's all the same fungus that's causing this. Typically one called trichophyton rubrum. So this, in the early literature about Down syndrome and skin, was really heavily emphasized. And I think to an extent, that's because a lot of those studies were done on patients who were institutionalized. And so potentially they were passing around this toenail fungus to each other. So I don't know how much we can kind of hang our hat that this is extremely common in Down syndrome. I will say, though, I know this picture is of a middle-aged gentleman, but I see this in younger patients with Down syndrome. And I have to say that toenail fungus is not a super common thing that I see in the pediatric dermatology office. So maybe there is something to this. Maybe they're a bit more prone towards fungal infections on the feet. In terms of treatment, if we're talking about a child, they oftentimes are pretty receptive to topical treatments, which is awesome. I can't really say that as much with adults, but there are quite a few different prescription topicals that work pretty well for toenail fungus. Honestly, my favorite one is cyclopirox. If you do that kind of on the nail and between the feet for a couple of months, oftentimes we can see some pretty significant improvement. There are oral treatments for toenail fungus. One that's commonly used is terbinafine. But that is something that if you're interested in using that, you should definitely talk to a dermatologist. There is blood work that oftentimes we have to watch, specifically your liver, because that medicine can sometimes inflame the liver, but that can be effective. I have to be honest though, toenail fungus in athlete's foot is sneaky. And even if you treat it, even if you get the nails clear, it might come back a year or two later. So it's really important that if you have this and you've treated and your nails are looking good, that you still pay attention to your feet and maybe use some antifungal creams in between the toes a couple times a week. And try to, keep those shoes open at the end of the day and let them dry out so that the fungus isn't growing in your shoes, and try to keep the feet dry, because there's nothing more frustrating than investing all of this time and trying to get rid of it for it just to come right back.
Right. And as I know, lots of the kids, they enjoy wearing their socks and shoes for much longer times than maybe other kids do.
Yes.
I wonder if that contributes. But you don't find that there's any difficulty, like with the cyclopirox, to topically put that on the nail for that to penetrate through and do the job it needs to do?
Yeah,
Okay.
Surprisingly, for kids, it actually can work pretty well. A kind of sock that I talk about, just, it's a great point. It's like we've got our socks and shoes on a bit longer than we might need to, is thinking about getting some wicking socks because they remove moisture from the feet a little bit better. It's annoying that they're not the cheapest things in the world, but even if you get a couple of pairs and you know that you're going to be in your shoes for longer periods of time, that's a nice sock to wear to kind of avoid that a lot of moisture on the foot.
Okay. All right. Well, let's look at our next patient who is 33 years old and has some thinning of the hair and wrinkling of the skin that's happening.
Yeah. So this I encounter in the office just kind of questions about, premature aging. Like, why do I notice the skin wrinkling sooner and the hair maybe thinning and going gray sooner? Sure, I don't know if I have all the answers to this.
Yeah.
It may have to do with like lower basal levels of DNA repair enzymes. I know there's some question about like oxygen-free radicals too, Kishore, and like maybe this is what's causing it. I don't have like great treatments for this, but this is certainly like a pattern that we notice. And so, kind of when I used to take care of more adults, and now really the only adults I take care of are those with Down syndrome, we talk a lot about the awesome power of wearing sunscreen, which we're going to talk about in a minute, talking about skin cancers. But like that actually really helps cut down on wrinkling. Everybody wants to come in and talk about fancy treatments for wrinkling. And oftentimes our answer is, hey, get a really good daily facial moisturizer that has some sunscreen in it. Not like 15, because that's like not enough, but something that has 35 to 50, and like that can be really helpful. Yeah. So yeah. Okay.
Well, I figured we wouldn't be able to get out of a dermatology podcast without talking about sunscreen.
Yes, of course.
So here is a 40-year-old who comes in with a pink bump on his back for several months, sometimes bleeding. So what is it?
Yeah. So let's talk about skin cancer. This really isn't mentioned a lot in the literature, but when we've looked back at our patients that we've seen in clinic, like skin cancer happens in patients with Down syndrome. And I think we're going to maybe hear about this more, fortunately, as lifespan continues to be longer and longer. So you can get skin cancer if you have Down syndrome. And so this picture is of a squamous cell carcinoma. We've seen basal cells, we've seen melanomas. So there's a couple of points with this. It is really important to advocate for both yourself and for your child or loved one that a complete skin examination, like once a year, is really important. And whether that takes place in the primary care office or if that means you go and see a dermatologist, I would advocate for that. Because a lot of the times these skin cancers happen on the backs of the legs, they happen on the neck and the back. And I don't know if people are thinking about that in patients with Down syndrome, but I really think they should. And I think we should be advocating for that. And then I also think that we should talk about sun protection. There's all different kinds of sunscreens. For younger children, I typically recommend mineral-based sunscreens such as zinc oxide or titanium dioxide. There's lots of great brands out there. I usually recommend wearing a sunscreen that at least has SPF 50 in it. I know that there's a lot of argument, like we don't need to go that high. Just a 30 is okay, but we do not apply it as thickly as we should. And we certainly do not reapply it as often as we should. Even being a skin doctor, I'm like guilty of that. And so it's better, to have a slightly stronger SPF and have a little bit more protection. And then lastly, at least I kind of felt this growing up, that we thought about sunblock as something that we just did when we went to the beach or we were outside all day. And we shouldn't think about it that way. We should think about it as, a little bit more of like a daily habit. And maybe trying to get it on before we go to school on our kids, and maybe try to, get it on ourselves on a more daily basis, again, as like a facial moisturizer. And I know all these things are time consuming and we have so many things going on in our life. And so I don't want to pretend that I'm not aware of that, but I think it is definitely worth discussing that we got to look for skin cancer in our patients.
All right. Okay, well, great. And so I guess just as we close up our podcast here, if there was just these few skin conditions, just briefly on some of these, I'll just pull up the pictures here. You can give us some thoughts.
Yeah. So I know some of these are really rare, but interestingly, these are what is like really noticed in the literature in Down syndrome. It's not a lot of these common things I've just talked about. So I was like, well, I think I should mention these. So, we talked about syringomas, which are those like little bumps around the eyes that we were saying are like, okay, they're nothing to worry about. They're kind of hard to treat. Well, we notice in Down syndrome that sometimes you can kind of get these all over, like you can get these all over the face and even all over the arms. And so that is definitely a recognized condition. There's, if you want to change to the next slide, there's another rare condition that's called Acanthosis perforans serpiginosa. Whoa, what is that? Well, this was actually like on my boards.
Oh, wow.
That it's more common with Down syndrome. And so basically it's like little outpouchings in the skin where something called elastin, which is in the deeper part of our skin, kind of pooches up through the top layer of the skin, and it causes these bumps. And this is pretty uncomfortable. Sometimes it's itchy. It's obviously quite noticeable. And we can see this in patients with Down syndrome. I've taken care of a few patients who have this. Okay. The next slide shows something called the milia-like calcinosis cutis, which means little white bumps. A lot of the times they're kind of hard, that can happen on the skin. They can happen around the eyes, and they also love the backs of the hands. We don't know why this happens. There's some thought that maybe there's a higher concentration of calcium in the sweat ducts in these individuals, but this is something that's pretty unique to Down syndrome. So I think it's good
something
to
that
know about.
I know I've seen, and I know that folks have maybe even diagnosed as a wart and things like that. Is there treatment for this, or do we just let it go?
Yeah, sometimes we can use some like keratolytics, like a tretinoin, but a lot of the times it is pretty tough to treat. So yeah. Okay. Yeah, and
then,
then this last condition, this is something that we really just see in newborn babies with Down syndrome, but it's called transient myeloproliferative disorder, and basically it's a bumpy rash. Sometimes it looks like little clear fluid bumps, or sometimes some little whiteheads. And it's basically a sign that there's a certain line of white blood cells, specifically myeloblasts, that are just growing and proliferating like really kind of out of control. A lot of the times it goes away on its own, but it can sometimes be a sign that that baby will develop a form of leukemia, within the first couple years of life. This is definitely a rash, that needs to be worked up. This can be a sign of an infection and like so many other things, but transient myeloproliferative disorder is definitely something that's well described in the dermatology literature. So it's good to know that that exists.
Well, I think that this has been an incredibly helpful podcast in connection even with the last podcast we did together. Really amazing. I really appreciate the time and the effort to put those pictures together for us. Any parting thoughts before we close our podcast today?
Yeah. Well, I mean, there's a few. I think one important comment is, don't forget the hidden spots. What do I mean by that? When I've gone through and studied dermatology and Down syndrome, I've just noticed this pattern, and you can kind of maybe see it through these podcasts, that there's a lot of things that go on the head, underneath the hair. And so we got to look there. We got to look for dandruff, seborrheic dermatitis. We got to look for alopecia areata. We have to take time and look in the armpits, right? That's where hidradenitis hangs out. And we have to take time to look at the bottom and the backs of the legs and the thighs. And then lastly, the feet. Take off those shoes and make sure that our patients don't have toenail fungus, and now we can make sure that we have some tools that can help them. So just don't forget those hidden spots. And then, second point is, I want people to feel like dermatologists are a key part to the Down syndrome care team. And because we really, we want to help you guys, and we're here to help. And then lastly, I'm here to help. I am more than happy to help anybody, be it a provider or a family, or a patient with any kind of skin, condition. Please reach out to me. COVID has kind of complicated things a little bit, but I'm starting a Down syndrome dermatology clinic up here at Dartmouth. So we're going to have dedicated time to see patients with Down syndrome and their skin conditions. This is a real kind of lifelong passion for me, and it gives me just nothing but pleasure to try to help people. So please don't hesitate, to reach out to me. I'm more than happy to help. And fortunately too, in pediatric dermatology and kind of dermatology in general, it's a really small world. We all kind of know each other. And so even I know I live in New Hampshire and you might live, in Georgia, but I might know some people in that area who can help you out. So, so happy to be a resource to help you guys.
Well, that is really great. And again, appreciate you being a part of our podcast, these last two. And for our listeners, I hope that you found this as helpful as I have. Certainly some things that I've learned today that I did not know before, and is definitely going to change my practice as well. So I really appreciate all that as well. So for our listeners, if you have any other podcasts or anything that you want us to discuss on a future podcast, please do reach out to us at Down Syndrome Center at chp.edu. We love hearing from our listeners. Anything that you could give us as any ideas would be wonderful. But until next time, bye-bye.